So again, welcome. This is Social Security Disability Insurance, SSDI, an overview of benefits and work incentives. Today is Wednesday, June 7th at 12 p.m. And we are welcoming our guest presenter, Richard, a public affairs specialist with the Social Security Administration. Just a quick disclaimer from the Arc of Lehigh and Northampton Counties. The Arc of Lehigh and Northampton Counties Advocacy Department does not employ lawyers nor provide legal advice. This training or any other provided by the ARC's Advocacy Department does not constitute or imply the endorsement, recommendation, or favoring of the providing party or any employees or contractors acting on its behalf. This webinar is being provided for educational and informative purposes only. Richard, at this time, we will turn it over to you.
Hi, folks. So good afternoon, everybody. Hope you're doing well, staying inside today, as we've been talking a little bit about. So we're going to go through a lot of things about the Social Security Disability Program. I want to take my time and just kind of go through this slowly because it's an interesting topic in the sense that we have some crossover here of different types of benefits, and sometimes, you know, it can be a little bit complex. So I know you guys can ask your questions at the end, but or put them in the chat, and we'll go through and we'll get you the information. So go ahead, next slide. So these are the topics we're going to cover today. And as we mentioned, Social Security disability is the main issue. And specifically under the disability program, we're going to talk about the eligibility factors for Social Security, the application process, what happens when somebody gets a decision. And that's pretty much going to be the first half, I'll say, of the PowerPoint. And then the second half is for once a person's on benefits and they want to go to work, what are the work incentive rules? How do they play out? That's very important to know that. And the Ticket to Work program, we're going to talk about that as well. So again, we're just going to go through this. First half is going to be all about the application process and benefits and the basics. So just talking specifically now about the programs we have at SSA, the Social Security Administration. Of course, we have the Social Security program overall. That's based on somebody having worked for a period of time and paid, you know, payroll taxes for a period of time to allow either themselves or somebody else in the family to collect benefits. So under Social Security, of course, we have retirement. Most people on the street, if you said Social Security, they probably think of retirement. But that's just one of the benefit programs that we have. You have to be at least 62 for retirement. I'll just mention that. Disability Social Security can be paid to anybody at any age if they've worked long enough for their age. And survivor's benefit, when a worker passes away, a spouse or a child, if they qualify, meet certain requirements, and they can also receive benefits. So we're going to, of those three, of course, we're going to focus on disability, although there is some spillover to the other benefits. And you see there, for survivors, of course, would be family members who would receive, but family members can also be entitled under the retirement or disability program. So you have someone who's worked, retires, somebody who works and goes on disability. If they have a spouse, if they have children who qualify, they can collect under that record as well. So I just wanted to point that out. You can have family members in all three of these benefits, okay? Okay, we'll go next. So as far as people receiving benefits based on disability, under Social Security, there's two types of recipients. And next week, we're going to do a session on SSI, which is the Supplemental Security Income Program. Okay, so that's a little bit different program. That's based on need. And you could have children receiving benefits there. But under Social Security, in terms of the disabled individual, himself or herself, it's either somebody who's worked for a period of time or who's going to file on their own work record, or someone who's going to receive on the work record of a parent. That parent would either have to be receiving a benefit themselves if they're alive, or if they're deceased, they had to have worked for a certain period of time before they passed. And so this benefit will be paid as a disabled adult child benefit. It's kind of an unusual term, but you see there, it sort of incorporates aspects of someone being an adult, being over the age of 18, but since you're going to receive on your parents' work record, there's that child aspect to it. So someone who's disabled and is over the age of 18, they had to have this disability before age 22. So The disabled adult child does not have to have paid into the system at all because they're filing on the parent's record. Okay, so we're going to talk entirely in this session today. We're going to be talking about folks who are 18 and older. Okay, and as we said, someone who receives as a child, they would be due benefits whether they have a disability or not up to age 18. We wouldn't even get into whether they have an impairment or not. So today we're talking about folks who are 18 and over and have a disability. Okay, so we'll go to the next. So under the disability definition, it is the same for both types of benefits. So whether a person is going to file for disability based on their own work history as an adult, or whether they're going to file as a disabled individual under their parents' record. The definition of disability is the same for both types of benefits. A person has to have some physical or mental impairment, which is either expected to last or may have already lasted 12 months or result in that person's death. So that's sort of the medical aspect of it. And in addition to that, their impairment has to prevent the individual from working at what we call a substantial level. And you see substantial has quotes around it because that substantial level changes every year. It went up from $1,300 and some last year to its current rate of $1,470 or more. So what that means is if a person has an impairment, which would meet our listings in terms of the severity of the condition, but they're pushing themselves or they're working and they're making $1,470 or more a month, that's a gross amount, $1,470 or more a month, they would be denied for disability because the work they're doing is at a substantial level. Likewise, if a person was making less than that, they could continue working at that job because the work would not be considered substantial, and they could file for disability and even be approved. So you might have a person making $1,000 a month, $1,100 a month, whatever, some figure under $1,470. As long as their condition meets the requirements that we have for different types of medical listings, then they can be approved and they can continue working. So we'll talk a little bit about that as we go through. So go ahead. But it's a two-pronged condition here. You have to have the condition and you have to have the condition preventing you from doing work at that level. Now, if you've dealt with Social Security or had some letters and things from them, you might have seen or heard us refer to the disability onset date. And the onset date of a person's condition, not necessarily when they first had the condition. A lot of times, obviously, folks have an intellectual disability, and most often they have that from birth. But the onset date refers to the earliest date the person's condition is severe enough to meet our medical requirements, and the person was not working above the substantial level. So for instance, you could have a person who has a medical condition which is severe enough, but if they're working, as we've already said, and they're making $1,470 or more, we would consider their work to be substantial, and if they filed a claim, they would be denied. But let's say that person's been doing that for the last year. They've been making over $1,470. It comes June of 2023, and now for whatever reason, they dropped their earnings down below $1,470. Well, whenever they do that within the month of June, that would be the date of onset we would establish for them. So let's say they did it today, June 7th, and they're no longer working at a substantial level, then their date of onset for this application would be June 7th, even though they've had this impairment for some time before that. Okay, so that's where the disability onset date comes into play, and you're going to see in a bit why it is an important date to establish. Okay, go ahead. Now, we've said that in this session here, we're talking about folks who are 18 and over, and they can either get a benefit based on their own work or on that of their parents' record. But if let's talk here for a second now, if someone's filing on their own work record, how much work do they need to qualify? Well, there's two aspects to that. First off, the person needs an overall total number of work credits in their life, and they also have to have a certain number of credits from recent work. So you need a total number, and then you need a certain number of credits right before you became disabled or right before your onset date. So you see there, this year in 2023, $1,640 of FICA earnings, paying the Social Security payroll tax of the job, gives you 1 credit. In any calendar year, no one can earn more than 4 credits in a calendar year. You make $1 million, you only get 4 credits for the year. So that's the most you can earn in a year. So to meet the overall requirement here at the top, a person needs 1 credit yearly from age 22 until their date of onset. But no matter what, they need a minimum of 6. So for instance, suppose a person's date of onset was at the age of 23. Well, when you first read this, you might say, well, they only need 1 credit from 22 to 23. No, you always need at least a minimum of 6, which is basically a year and a half of work, gives you 6 credits. Okay, so that's the overall at the top, the first bullet. That's the first half. We'll go to the next one. And then in addition to having that overall number, you also need to have worked fairly recently before becoming disabled or having your date of onset. So if you're filing on your own work record, how much recent work you need is dictated by how old you are at the time you're filing this application. So here we see on the first bullet, if someone becomes disabled before age 24, so they need 6 credits in the 3-year period prior to the onset. So basically how this works is we look at from age 21 up to 24, that's a 3-year period. They could have earned 4 credits a year for 3 years. That would be 12 total credits they could have earned, but they need to have at least 6 in that 3-year period. So if they only have 4, let's say, or 5, they're not going to meet this requirement. Plus they also wouldn't meet the 6 credit requirement overall. If a person's a little bit older when they become disabled, or at least when they're filing the claim, and the example here is if it's a period between 24 to 30, then they need credits for half the time from age 21 till their onset. So let's say they're 27 and they're filing this claim. From 21 to 27 is 6 years. They need to have worked 3 of those years. 3 of those years would be 12 credits, 4 credits a year. So you would need 12 credits during that time. And then the last bullet there is the situation we in Social Security encounter most often. Most of the time, people who file for disability are filing at an older age. If you're disabled at age 31 or older, you need 20 credits in the 40 credit period prior to becoming disabled. So a 40 credit period, because you can earn 4 credits in a year, a 40 credit period covers 10 years. So we at Social Security, for the folks at the 31 and older, we would say, do they meet 20, 40, or 5 of the last 10? You need 5 of the last 10 years to have worked and paid into Social Security. So sometimes people fall out of the workforce, even though they've done work for a while, and then they go, 5 years, 6 years, 7 years without working at all. And sometimes that presents a problem because then they do not meet this recent work requirement. So, for a young person, I know we're talking probably about young disabled adults here today. They may only need a year and a half of work. Again, this is if they're filing on their own work record, not on their parents' record. Because if they're filing on their parents' record, they don't need to have any work history. The parent has done the work and paid the taxes. In this case, we're talking here about a young person getting Social Security on their own work record. Okay? All right, next. So those are the basic eligibility requirements. Now, if someone was going to file a claim, there's 3 ways to do that. If the person is filing on their own work record, not on their parents' record, but on their own, you can file online at our website. You can do the entire application there online, the whole thing, which would be medical information and non-medical information. If a person doesn't want to do it, you can only do it that way, though, if you're filing on your own work record. If you're filing as a disabled adult child, you have to go through the office. Okay, they have to do it. You can also file the more traditional ways by phone or in the office. If that's what you prefer to do, you don't want to bother with online, you'll call our 800 number, our toll-free number, and you can reach them 7 to 7 on weekdays and say, I want to file an application or have an application taken for my son or daughter. And then we will set you up with an appointment day and time to do it either in person or over the phone, whatever's convenient for you. Okay. So those are the ways you can file an application. Now, once the claim is filed and we have medical information, where this person's been treated, who has their records, who has their evaluation that it may have been done by schools or whomever, The medical portion goes up to what we call the Disability Determination Services Site, commonly called DDS. We have a contract with the state of Pennsylvania, and these are state employees, disability examiners, physicians, who will receive the medical records, and they will make a determination about whether the person is considered to be disabled according to our regs or not, okay? So in this area, there's a DDS site in Harrisburg, there's another one in Wilkes-Barre, there's another one elsewhere in Pennsylvania. And generally, it takes about 90 to 100 days for the disability folks to make a decision. They would then notify the local office, and the local office, if it's an allowance, would move to pay the person. Or if it's a denial, we'll talk about that in a second, what happens there. But the local Social Security folks, they do not make the medical determination. It's done by the state. If the claim is approved, then benefits are due after a 5-month waiting period is served by the person. So for instance, suppose, for the sake of today, we're saying the onset date is today, June the 7th, and the person is approved. DDS says, yes, this person was disabled as of June the 7th. Entitlement would begin after 5 months have passed. So 5 full months starting with July, August, September, October, November. That would mean the person's first month of entitlement is December of this year. And then Social Security benefits for a particular month are paid the following month. So the December benefit is paid in January. So that's the timeline there. Person's disabled as of today, they can expect a check in January if they're approved. Now, the one exception here to the 5-month waiting period down at the bottom is that a disabled adult child does not have to serve a 5-month waiting period. Okay, so they would start their benefits right away if they're found disabled. They do not have to have that 5-month waiting period. But anybody filing on their own work record at the top, they would have to serve the 5-month waiting period. And you don't get paid back for those months. Sometimes people think they're going to get paid later on. They're not. That's to ensure that the decision is correct, because if a person, let's say, returns to work during that 5-month waiting period, that could call into question the whole disability decision, and they might send it back for a whole new decision on the case. Okay. A couple things if the claim is approved. The maximum payment retroactivity on a case is 12 months prior to the application date. Generally, this happens when a person or a family does not file right away for the person as soon as they become disabled or as soon as the first opportunity comes along. So sometimes if they delay, there could be retroactivity, because the 5-month waiting period also always has to figure into this timeline. Okay, but so most people file pretty much as soon as they are aware of it or know about it, or whatever. And how much does a person get? Well, if they're filing on their own work record, the amount's going to be dictated by their work history. If at the bottom they're filing as a disabled adult child on a parent's work record, then it depends on whether the parent is alive or deceased. If the parent is alive and receiving Social Security, which they would have to be, the disabled adult child will get 50% of the parent's full benefit. So the parent could be receiving retirement or disability themselves. Whatever their full benefit is, the disabled adult child will get 50%. If the parent is deceased, then it changes to 75% of the parent's full benefit. Okay. And sometimes if there's a number of people on the record, there's a maximum amount of benefits that can be paid on a record. So sometimes those percentages are adjusted. The disabled individual, whether it's filing on their own record or at that of a disabled adult child filing on a parent's record, they can get Medicare, but they would be entitled to Medicare after they've been receiving benefits or been entitled to benefits for 24 months. So someone becomes entitled to a cash benefit. The month of entitlement is at sometime in the age of 25. 2 years later, at 27, they have Medicare available to them if they want it. Okay. All right. If the claim is denied, then when a letter is sent out, upon receiving that letter, the individual or the family has 60 days to file an appeal. The first level of appeal is called a reconsideration. Under the reconsideration, we would get some information about the person's condition, update things. If there's any new medical sources, we will get that. The claim then goes back up to the DDS, and a whole different set of people who did not work on the first decision will work on the reconsideration. It's probably also going to take a few months. And then once that decision is made, if it's an allowance, then the local office will go ahead and move to start paying the person. Excuse me. If the reconsideration is denied, you have other appeals that remain. The next level would be a hearing. After that would be a counsel review if you're turned down at the hearing level. And then finally, if you're turned down there, you could actually file a lawsuit in federal court. So, and it's good if someone is denied, obviously, if you think that decision is wrong, to file an appeal because it keeps the claim active. And, you know, if you're approved at the appeal level, generally they're going to pay you all the way back to the application date, whatever that application date would dictate, as opposed to if you let the 60 days pass or let it be 90 days and then you come back in or contact us, it may be that if you're approved that time, they may only pay you as of the second application date. So it sort of depends on some things, but it's always good to appeal. You keep the claim active, you keep it going, and you would not miss any potential payments if it's approved. Okay. So that's the first half. I don't know, Jessica or Cody, if we want to take any chat questions now or wait till the end, because this will be now about for somebody who's on benefits and wants to work.
Sure, sure. I mean, we could do a couple. We're just obviously going to remove any names from them. But in the Q&A, we did get a couple that came in, so I'll run through those for you. So this person said, my adult son has autism and is currently receiving SSI. I am 65, but not yet drawing Social Security. When I start drawing Social Security, will my son automatically start receiving SSDI?
No, it's not an automatic process. It used to be to some degree, but now you would actually have to file an application. So assuming though that, you know, the son obviously has a disabling condition because he's receiving SSI, I would think it would be pretty much certain things that they would be approved for disability because it's the same criteria for medical as it is for SSI. So, but you'd have to file an application.
Okay. So this person's son is not working, has no income. How much SSDI will the child receive when this person starts drawing from Social Security?
Okay, well, they have, I'm assuming they haven't worked themselves, so that would eliminate them getting any benefits on their own work record. And then it just becomes a matter of, as we said on the percentage, if they're going to receive on the record of a living parent, they would receive 50% of that parent's full benefit. If they're going to receive on the record of a deceased parent, it will be 75% of the deceased parent's full benefit. Yeah.
And then just to clarify that, this person said, if I wait till age 70 to maximize Social Security, will my son get 50% of the higher Social Security, or will it always be tied to the full Social Security benefit at my full retirement age?
Right. That's a good question. Yes, the benefit will be computed on the worker's base benefit at their full retirement age. Okay. The only time a family member will have their benefit computed on the additional percentages that for someone who waits till 70, the only time that would happen is if it's a spousal situation and the person dies and there's a widow or widower. They would have their benefit computed on the 132% amount or whatever it might be. But no, the benefit for the disabled adult child would be the 100% benefit that the person would have gotten at full age.
Okay,
great. That's a good question. Good question.
Great. And then we just did get one more. My son receives SSI because he is diagnosed with autism and intellectual disability. He is 19 years old now. Can I apply for SSDI for him even though I'm not at the age of retirement?
No, because there'd be no record on which he could receive a benefit because he either have to have his own work, which, you know, if he does, he has to have about 1.5 years of work. But if the parent has not yet taken benefits, even though they may be whether they are or not at retirement age, if they haven't taken their own benefit, there's no benefit payable to the adult son or daughter.
Okay. We had another one.
So Jessica, that's a consideration sometimes for people though.
Right.
Because, you know, that's, okay, maybe they would get somewhat less on their own, but then you also have to figure there would be that income coming into the household. Obviously for the child, adult child, but sometimes people look at it that way, and that may change their ideas about taking retirement at a particular age.
Right. Okay. A third one that came in, another question about an autistic adult child. Did you say they can't apply online, or is that still an option? Whether it is or isn't, is it better to apply in person?
Well, first off, they can only apply online if they have some work history themselves and they're filing on their own work record. If they're filing on the record of a parent, they cannot do that online. Our system isn't that sophisticated to handle that. So you would have to set up an appointment either by phone or in person with the local office. And then I'm sorry, what was the second half? Is it better to do one or the other?
Yes.
I'll give you the party line. It shouldn't be. I mean, as far as I know, it doesn't make any difference, because it's a matter of providing us with the medical sources, the treatment sources, things like that. And as long as you do that and give a good history, should be okay either way.
Great. All right. Those seem to be the questions.
It's whatever the person's most comfortable with. I will say that.
Okay. Those are the questions we've gotten so far for our attendees. If you ask that question, you have more clarifying, feel free to put that into the Q&A or into the chat, and we will answer those at the end of part 2. Thank you, Richard.
Okay, thank you. And folks, you see there, based on even some of the questions, even though we're going to be doing SSI next week, there is a lot of crossover back and forth with these benefits. That's why sometimes it's difficult to cover the whole enchilada of all kinds of benefits here, because it crosses over to a lot of things. It's just the way it is. So we'll be doing SSI next week. So what we're going to talk about now, the remainder of the PowerPoint here, is on someone now who's been approved and they're started to receive their benefits and they want to work. How does that play out with things? So we're going to talk about the work incentive programs. We'll talk a little bit about a publication I think would be good for you to get your hands on, is the Red Book, and the Ticket to Work program. So go ahead, Jess. So now this is, again, benefits for the individual, whether they're receiving on their own work record or whether they're going to be receiving as a disabled adult child. This is what happens if they want to go to work once their benefits start. So they have a trial work period available to them. And this is a period of time where a person can work in 9 individual months. And regardless of how much they might make at a job, they always receive their full Social Security benefit, okay? In order for one of the months count as a trial work month, earnings must be at least $1,050 in a month. So let's say a person goes out and gets a job and makes $900. Well, they're supposed to tell us about that, but in reality, it's not going to have any effect on the trial work period. It's not going to count towards anything really, because it's not at the minimum amount of $1,050. So, and then the next month, if they make $1,100, now they've had one trial work month in the books, okay? And these 9 months can be scattered over a 60-month period, so over a 5-year period. So if a person works 7, 8 months and then they stop and then they go back 3 years later, once they do another month or 2, they're going to be completing their trial work period because it's within a 5-year period, okay? So go ahead. And that figure, 1,050, that'll change every year. It'll go up somewhat next year. So after a person has worked in 9 months, because you have to report to us that you started to work or your son or daughter has, and we'll keep account. Okay, what are your estimates? You're going to figure that he's going to make the same amount each month. We'll sort of keep a running tally. And then once we confirm that the individual has completed 9 months of work for the trial work period has been completed, then we're going to look at, and they're going to keep working, we're going to look at whether the work is considered substantial or not. So it would be considered not substantial if it averages out to be under the 1,470 over those trial work period months. And so then the benefit would just continue. So maybe the person's making, like I said, $1,000, $1,100 a month. Obviously, that's not 1,470 in terms of an average each month for the 9 months. It would just continue. If, however, the work is considered substantial, it's 1,470 or more, and the person is going to keep working, then we will pay for another 3 months. These are called grace months. So you have the 9 months of trial work. You always get paid for those months. Then we say, okay, your work is substantial going forward. You're going to keep doing it. We pay you for 3 more months, months 10, 11, and 12, and then the benefit is suspended. Okay. Now that sounds a little dire. It's not as bad as it sounds. Let's see on the next slide. So you've completed 9 months of trial work, 3 more grace months, benefits are stopped. So now beginning with month 13, we have what's called you're in what's called the period called the extended period of eligibility. It's a typical government term. It goes from month 13 through month 45. So we're almost talking up to 4 years here from when the person first started working under trial work. So they completed 12 months of trial work, the 3 grace months. Okay. I'm sorry, the 12 months of trial work and the grace months, that's the 12 months. This extended period runs for 33 more months up to month 45. And what happens during this time is the person could be up and down, off and on a benefit. It's almost like a roller coaster ride, it could be. So the benefit would not be paid for any months from 13 to 45 if the work is substantial. So person's making $1,100 a month, keeps getting paid. All of a sudden they make $1,500 one month for whatever reason, they jump up. That would be a month we wouldn't pay you. Next month they drop back down to the 1,100. We're going to back, as the last bullet says, we're going to start paying again. So it could be up and down, or a person might work for a year and maybe they lose their job or it doesn't work out for them. So then, they're not making that money anymore. They will be paid again. Okay. So it could be up and down period, but it runs a number of years here. We're almost talking 4 years for this whole process to play out. So go ahead, Jess. I'm going to talk in a second as to what happens once you get to the end of the extended period. But one other thing, which is a good provision that people have available to them, is called the impairment-related work expenses provision. And what this is that after a person does their 9 months of trial work, if they have to pay for certain impairment-related items or services that they need in order to work, to do their job, whatever they pay for these expenses can be deducted from earnings in determining whether the work is considered to be substantial or not. So the example here, somebody makes $1,600 in a month. Now, $1,600, of course, is over the $1,470, so that would be considered on the surface substantial work. But in that same month, they paid $175 for these impairment-related work expenses. It could be somebody who's helping them get dressed in the morning. It could be some special equipment they need at their job. It has to be something that they're paying for. It can't be something that's going to be reimbursed by an insurance company. It has to be a reasonable cost to the item, and the item must be paid for in a work month. So when a person goes to work and they're receiving disability, we will ask them about this. Do you have any special expenses or things that you pay for? Whatever number of things, there's a whole list of things it could be. So that would be taken off. So again, that would mean in some cases, even though the person earns $1,470 plus, they're not going to be considered doing substantial work, and they would get paid for that month, the Social Security check. Okay. All right, just. So we said that this extended period of eligibility runs all the way out to month 45, up and down, off and on the program, depending upon your earnings. When you hit month 45, that's the last of these extended period months. Any substantial work, SGA work in the month 46 or later is going to quote unquote terminate their eligibility, which also sounds very dire. Okay. But the benefit would stop. But you see the but at the bottom there. So we'll go to the next one. And if the person later drops down below the substantial level, there's a provision called expedited reinstatement, where they can get back on benefits without filing a whole new claim. So they've gone on, maybe they went for another 6 months or a year, maybe they're up to like month 55 or 60 or something. And then for whatever reason, their earnings go back down below and they're going to stay below. Well, then they would request this expedited reinstatement. We don't have to get a new application. We would start to pay the person again, as long as it's within 60 months of when their benefits were stopped. You have to have the same disability. You're applying on the same disability for which you were receiving benefits before. And you can receive up to 6 months of benefits and Medicare while waiting a new decision, because we're going to ask for updated medical information. They're going to make a new determination. And if they approve this person again, then they basically start over again. Okay. So if they have the same disability, which most often is the case, they can file, but they would not need to file a whole new claim. They would just need to provide us with medical information. Okay. So not that you folks have to know all these things and all these numbers and all, but just know that the work incentive program is a good program which allows people to take an opportunity, if they have it, to work, and they shouldn't have the fear they're going to lose immediate benefits or immediate health care benefits, or even if they do work for a good period of time, that they would never be able to get back on the program. So that's what would happen with this expedited reinstatement if this situation presents itself. Okay. As far as healthcare covers, continuation of Medicare, all disability beneficiaries are Medicare eligible after 24 months of benefit entitlement. We said that at the beginning, that after you're on for 2 years, you get Medicare, you have Medicare available to you. When a person works and they complete their trial work period, Medicare can continue for another 93 months past the original 9 of the trial work period, regardless of their earnings level. So you could be in a situation where you're making enough money not to get paid at all, but your Medicare is going to continue for at least 93 months, at least past the original 9. So 9 and 93, that's 102 months. That's 8.5 years of receiving Medicare, not worrying about anything's going to happen to it. And depending upon their situation then in terms of work, they might continue on still with Medicare, or you might be able to purchase it if you need be. But that's a pretty good period of time. It's like 8.5 years after they very first start work. Okay, so go ahead. And for SSI, Medicaid is what people receive on SSI, but not Social Security. Medicaid's an automatic for SSI. So I mentioned before that the Red Book, this is a book which actually has a red cover. And if you go to our website under publications, or even just do a search for Red Book, you will see this book. It's pretty long because it covers Social Security and SSI, all the work incentive, all the things we're talking about now. And you can get a printed copy if you want. You can order it. It tells you how to order it on through our website. You can do that, or you might want to just look at it. It's all online as well. You can look at it that way and maybe focus on the things that are of interest to you. But I think this is a good book for someone who has a person who's has a disability and wants to work, because this covers a whole lot of things. There's even other things I haven't talked about here today, which are a little more obscure, but you know, the Red Book will be good. Okay. And our last couple of slides here on the Ticket to Work program. You probably heard of the Ticket to Work. This is a program which we make available to anybody who's on disability, whether it's Social Security or SSI, anybody who's at least age 18. And under the Ticket to Work, people can receive free employment services, whether it's career counseling, voc rehab, job training, job placement. Sometimes people need help writing resumes. There's a whole bunch of services that are provided for free. The program is strictly voluntary. You can do it if you want. If you don't want to do it, that's fine. Or if you start and you want to drop out, that's fine. There's no consequences to that. It's designed to help people become self-sufficient. Ultimately, it's designed in time to hopefully get people off the benefits and be able to work on a continuous basis and support themselves. Okay. So go ahead, next one. So what about the Red Book? Where do you start? Well, a couple ways. Like I said, you can go online, but also there's a Ticket to Work helpline. There you see the number, toll-free number. There's a website. You go to our website, ssa.gov, you're going to be able to find some stuff, but ultimately they're going to take you over to this other website called Choose Work. And there you see it's choosework.ssa.gov. And that has a whole bunch of information about, there's Ticket to Work seminars, there's events in the community, there's different things about it. And I should explain that the Ticket to Work has a lot of providers who provide all these different services. So in your county where you live, there might be 20 or 25 organizations that serve the county, and they could provide services either in person, or it could be online, could be virtual. And they provide services a lot of times for people with specific types of disabilities. So you might find that this particular provider works better with people that have autism as opposed to some other condition, whatever it might be. And at this Choose Work website, there's an online find help tool. which can help you say, okay, I want to search for providers in my zip code or within a certain 20-mile radius or things like that. So you basically have to go in there and just kind of play around with it. And, you know, ultimately you would assign your ticket, in theory, assign it to a provider. You can only be involved with one provider at a time. So if it turns out it's not a good fit for you or for your son or daughter, then you would take your ticket and go to another company, but you can only be involved with one at a time. Okay.